Hi, this is Brian with Open Dental Software, and today we're going to be doing a demo of the Open Dental eClinicalWorks interface. So to start off, I'm here in eClinicalWorks. eClinicalWorks will be your primary software for everything that's not specifically dental related. So all of your demographics will be handled by eClinicalWorks. You'll create new patients in eClinicalWorks. You'll create appointments, updating addresses, social security numbers. All that information will be handled in eClinicalWorks. All of your billing statements, insurance claims will be handled by eClinicalWorks, as well as your medications, allergies, problems, any meaningful use data that you enter, and all of your appointments will all be handled by eClinicalWorks. Open Dental will handle your dental charting and treatment planning. So for our demo, we're going to walk through a typical patient encounter from start to finish. So we're going to say that your patient has just called for the first time and walk through creating the patient, charting some work, generating treatment plans, and show you how everything transfers from eClinicalWorks to Open Dental and back. So the first thing I'm going to do in eClinicalWorks here is I'm going to create my new patient. So I'm going to use my patient lookup tool here, and I'll select new. And I'm just going to enter some general information about my patient. Okay, so now I've created a new patient in eClinicalWorks. The great thing about the interface is that that patient will also be created in Open Dental. I don't have to add the patient twice. The name, address, all the demographic information will automatically transfer over to Open Dental without me having to do anything. So I'll click OK. The next step is to go ahead and create an appointment for this patient. So I'm going to come to my resource scheduler here, and I'm just going to double-click on the calendar and make my appointment. So when I get to the visit type here, it's very important that I specify a dental visit type. So eClinicalWorks has certain visit types that can be flagged as dental, and that tells eClinicalWorks to send a message to Open Dental and create the appointment. So I'm going to use a dental visit type here. And I'll click OK. It's going to warn me that it's not within my normal working hours, which is fine. And I have my appointment here in eClinicalWorks. Now, again, just like the patient, that appointment automatically shows up in Open Dental without me having to do any extra work. So from here, I would probably get a medical history. I would discuss medications, allergies, kind of get some general information for the patient, and you'll do that here in eClinicalWorks. So we're going to assume that that's all been completed, and we're ready to go on to the dental charting. From eClinicalWorks, there's 3 different ways to launch the dental chart. The first way is I can right-click on my appointment and select View Dental Chart. The second method is from my scheduling button here. If I go to my scheduling button and locate my appointment, here's my encounter for the day. I can double-click on this encounter, and it will take me directly to Open Dental. The third option is if I'm in the patient's progress notes, from down at the bottom of the screen here, I have a Details button. The little green arrow next to the Details button, I can click on that, and I can get to the dental chart from there as well. So depending on where you are in eClinicalWorks, there's multiple ways to launch Open Dental conveniently. One other thing I want to point out before we go ahead and go into Open Dental is the medical panel here. So eClinicalWorks has a medical panel on the right side of the screen. In the progress notes, it lists things like problems, medications, allergies. If I go to the other tabs, I can see things like lab cases, referrals, patient documents. The medical history is here. All of this information in this panel will be available in Open Dental as well. So this is how, even though you're going to enter your medications and your allergies into eClinicalWorks, you're going to be able to see them in Open Dental as well through this panel. So now we're ready to go ahead and launch Open Dental. We're going to go ahead and start doing some dental charting for our patient. So I'm going to go ahead and click this arrow and View Dental Chart. All right, so now here is Open Dental. So I can see on the top right of the screen I have my 3D tooth chart. These teeth are movable, rotatable. As I chart treatment, it's going to show up there. It's a very handy way to get a nice quick overview of the treatment for the patient. On the bottom right, I have the medical panel that we discussed. All the information that was there in eClinicalWorks is also here in Open Dental, so I can easily see medications and allergies, patient documents, all that information. On the bottom left here, I have my progress notes. So I can see the only thing in here right now is my appointment for today. It did automatically show up from eClinicalWorks. As I start to chart more work here, I'll see more and more things in the list. The top left here, this is where we go to enter treatment. So we'll do a lot with that today. And then on the left side of the screen, I have some other modules that we'll discuss in a little bit here. For right now, we're going to go ahead and get started with our new patient. And the first thing you're probably going to want to do is kind of match some of the highest level things for the tooth chart here. So for example, maybe the patient is missing some teeth. So I'm going to click on the Missing Teeth tab and select some teeth. Now, I can click on the number for the tooth, or I can click anywhere on the tooth. I can even click and drag to select multiple teeth all at once. So very easy to select teeth. And from here, I can go ahead and say they're missing. If I want to, I can hide the number. So I can hide the little number 2 there to kind of make the tooth chart look a little bit cleaner. I can always put those back in, indicate that these teeth are not missing. I can easily mark the patient a dentulous with a single click. Very convenient. Next up, maybe we want to indicate some movements. So for example, I'm going to indicate maybe there's an impacted tooth here. So I'm going to click on tooth number 17 and maybe do a mesial tip and an occlusal shift. If I shift the tooth far enough, it will actually turn gray to indicate the tooth is unerupted. And I can do rotation, mesial tip, and labial tip in degrees, and shift mesial, occlusal, and labial shift in millimeters. Very easy to customize this to match the patient's mouth. Permanent versus primary. I can easily set all of the teeth to primary. I can set them all to permanent, or I can set them to a mixed dentition, which is the standard for around 8 to 12 years old. And then from here, I can click on the tooth, and I can select either the letter or the number and indicate maybe that these 2 teeth are permanent. So very easy to set that up. For now, we'll go ahead and set them all back to permanent for the rest of our demo. And we'll go back to our Enter Treatment tab. So we've kind of matched some kind of high-level stuff. The next thing to consider is maybe this patient came in with some existing work. So maybe they have a couple of existing fillings that were done by another office that we want to chart on our treatment on our tooth chart here. So the first thing I'm going to consider is the entry status. So right now it's set to treatment plan, which is pretty obvious. It's work that needs to be done for your patient. We can chart work directly to complete. Now, usually you would treatment plan something and then set it complete, but if you want to, you can chart directly to completed work. I have 2 statuses for existing work, so existing current provider and existing other. This is the status you would use for work that's already been done in the past, either by your office or by a different office. Referred work would be work we're sending out to someone else, and condition is just another status you can kind of use to track something else. You could use it to keep an eye on something, or just kind of another status you can use. So for now, I'm going to say existing other because we're going to chart some work that was done by a different office. And I'm going to use these procedure buttons here in the middle of the screen to chart some work. These are the fastest, easiest way to chart work. They're completely customizable. You can easily set these up for the types of procedures that your office does most often. They can chart multiple procedures with one button. If you have a new patient exam and you want it to automatically chart a comp exam, a pano, a prophy, and a fluoride, you can easily set up one button to chart all those procedures. They can tell the difference between different types of teeth. So if you want to have one button here that charts a certain code for a permanent tooth and a different code for a primary tooth, you can do that. They can tell the difference between pontic and retainer, permanent versus primary, molar versus premolar. They can tell 1, 2, 3, 4, 5 surfaces and chart different codes based on the number of surfaces. Very, very customizable. So for now, I'm going to start with the quick buttons. So these are the most common filling surfaces, and I'm going to go ahead and highlight a tooth here, and we're going to say that this patient came in with a posterior MOD composite. So I'm going to click on the MOD button, and I can see I get the correct code 2393 for a 3-surface posterior composite. Just for comparison, I'll do an amalgam on the tooth next to it. So if I do the same MOD amalgam, I can see that they both show up in green, so that easily indicates that they were done by another office, but there's also a slightly different shade. So just by looking at the tooth chart, I can easily tell that this patient has 2 fillings, they were done by a different office, and one of them is a composite and one is an amalgam. For now, we'll go ahead and switch back over to treatment plan, and we're going to go ahead and start treatment planning some work for our patient. So for an example, let's just go ahead and do another filling. We'll go ahead and do, in this case, we'll say that we want to do one that doesn't match these buttons. I want to do a different surface combination. So the other way I can chart a filling is I can choose my tooth. I can choose my surfaces. So I'll come over here on the left and choose my surfaces. I can see it automatically selects the occlusal surface here. And then I would go to my category here. So I have a fillings category and I have amalgam or composite. So I'm going to go ahead and just say we're going to do an amalgam in this case. And I get the correct code 2160 for a 3-surface amalgam. So in this case, I only have one button for an amalgam and one button for a composite. I don't have to tell it that it's anterior or posterior. I don't have to tell it the number of surfaces. It just automatically charts the correct code. I can see that it shows up in red. Red is the color for treatment planned. And I'm ready to move on. So a couple other examples. I'll highlight these 3 teeth here and do a bridge. So if I wanted to do a bridge, I can highlight all 3 teeth at once and click on my bridge option. And I can see that I automatically get the correct code on tooth 1 and tooth 3. Both get the 6740 and the pontic gets the 6240. So I was able to tell the difference between the pontic and retainer and automatically chart the correct code for all 3 of these teeth. Another great example, let's do a root canal build-up seat for tooth 16 here. So with the click of a button here on tooth 16, I automatically get a crown, a core buildup, a root canal, and a seat. If you have your own codes that you want to use here, if you have an additional code every time I do a root canal, I want to have this extra code. Again, it's very easy to customize these to match the procedures that you do most often. If you don't happen to have a procedure button set up, you can also chart directly by procedure code. So for example, if I wanted to do an extraction on tooth 14 and I already know what code that I want to use, I can come up here and just type in my procedure code. Click OK, and I get my extraction on tooth number 14. If you use these and you don't specify enough information, OpenDental will pop up and warn you that you might need some extra information. So for example, if I want to do, let's say I want to do an amalgam, a 3-surface amalgam. So we'll go ahead and choose a tooth here, and we'll say I want to do an amalgam. We'll do the 2160. I'll go ahead and click OK, and it's going to pop up a box warning me that I didn't enter all the information that it needs. That's a 3-surface amalgam, and I only entered the tooth number. So here I'll go ahead and enter a couple of surfaces. And in this case, I'm going to say maybe I changed my mind. Maybe it's only going to be a 2-surface. So when I click OK, OpenDental is going to warn me that it's going to recommend a 2150 as the correct code for a 2-surface amalgam instead of the 2160. So OpenDental is always kind of checking things and trying to make sure that everything's accurate. So we're always trying to look for anything that might be an issue on an insurance claim and just make sure that everything's correct as you go. The next way to chart work, so we have our procedure buttons here. We have you're able to just type in the code. Another way that you can chart work is you can look it up in a list. So for example, we'll do a surgical extraction on tooth 17 here, and we'll say that we don't have a procedure button for it. We don't know the procedure code, so I can always go to my procedure list here and see a list of all of my codes. So this basically has all my codes in it. I can search by abbreviation, by description, by code, or by category. So in this case, I'll go to my oral surgery category. I can see all my codes here, and we'll say I'm going to do a surgical extraction. And now I have my surgical extraction on tooth number 17 here. Now, maybe I want to refer out that surgical extraction. So what I would do is I would indicate referred status and then chart the procedure, and it would automatically be a referred status. We can see here the status of all these is treatment planned. If I forget, like this case, maybe I've already treatment planned it and I actually wanted it to be a referred status. It's very easy to modify any procedure codes in OpenDental. So I can always come down here. This is my extraction. I'll double click on it. And this lets me change the tooth number. I can change the build amount. I can even change the procedure code if I say maybe I've already entered my notes and I want this to be a regular extraction instead of a surgical extraction. I can change the date if I need to. I can change the procedure status here. So for example, I'm going to go ahead and say that this is actually going to be referred out instead of treatment planned. This is where I would enter notes, so we'll come back to that in a little bit here. And I can even enter more information on my referral. So for example, here I'm going to go ahead and use this option. I'm going to refer this to, and we'll say maybe Dr. Smith in oral surgery. I'll say OK. And now I can generate a referral slip if I want. So the referral slips are completely customizable. You can easily have the office logo of the office you're referring to here. By default here, it has their address, some patient information. Now I haven't entered a work phone number or address or any of that for this patient, so it looks a little blank. But I can come in here and enter notes. I can print, email this referral. I can create a PDF, and if I click OK here, I can see that this referral is going to be tracked in the patient's notes here. So I have my oral surgery referral slip here. I can always go back to it. By entering the referral here, you can also keep track. You can run reports and look at all of your referrals, how many people have been referred to you, how many people you've referred out, and check the status of any referred work. So now that we've entered some work, we've looked at a whole bunch of information here. We've kind of got a lot of stuff in our progress notes here. So at this point, you might be seeing more information than you're interested in. Maybe not everyone wants to see all this treatment planned work, or maybe you don't want to see this existing other work, or maybe you're just trying to find this referral slip and you're having trouble finding it. You can always go to the Show tab here and change what you can see in the chart. So for example, I usually start with none, and then I can indicate that maybe I want to see appointments and existing work. Maybe a different provider wants to see appointments and treatment planned work. You can select any status. You can select appointments, communication logs, emails, lab cases. If I was looking for that referral sheet, I could say I just want to see sheets. And now, very easy, the only thing in the list is the referral slip here. I can indicate selected teeth. So for example, if I wanted to see everything that was treatment planned for, or everything that was treatment plan completed, everything that had happened for tooth number 16, I can highlight that tooth and choose selected teeth. So now I have everything that's in the chart for that one particular tooth. I can enter a date range. So if you only want to see procedures from this year, you can easily set the chart to only show from this year, last year, and you can even enter a custom range to say whatever range of information you want to see. And then you can save those views. So for example, here our F1 is a saved view that basically has everything. Our F3 is a saved view that only has the treatment planned work. So now, without even going to the Show tab, I can easily just hit F1, F2, F3. I can use these shortcut keys to move between different views. So very easy to set this progress notes area up to show you just exactly the information you want to see. The last tab up here, the Draw tab, is useful to indicate anything that we don't already have a graphic for. So we already have graphics for crowns, bridges, fillings, extractions. All those kinds of things already have existing graphics, but if you wanted to draw something that didn't already have a graphic, so for example, maybe a crack in a tooth, you could easily draw in here and indicate maybe there's a crack on a tooth. Or maybe you want to indicate an abscess. You could kind of draw that on here. It just gives you the flexibility to add anything that doesn't already exist. Very easy to erase and easy to change color. So the next step, we've treatment planned a whole bunch of work. Maybe we've talked to our patient about this. We want to go ahead and generate a nice looking treatment plan for our patient. So there's kind of a lot of stuff in the treatment plan here. I want to organize it in a nice clean way for my patient. So I'm going to go to my treatment plan module here. And here I have all the treatment plan procedures. And I can see up here, this is the default treatment plan. This is a live treatment plan. It will update as you go. So if I were to go treatment plan some more procedures, they would automatically show up in my list here. And if I complete, for example, if I were to complete this bridge, it would automatically disappear. This list is always a current list of treatment for your patient. I can easily prioritize it. So maybe we're going to say that our next visit, we're going to do maybe the 2 fillings here. So I'm going to go ahead and say those are our first priority. The next priority, maybe we'll go ahead and say, is our extraction. So we'll set that as priority 2. We'll go ahead and say that the bridge is priority 3, and maybe we're going to go ahead and hold off on the rest of these procedures here. So I'm just going to go ahead and say wait. Now, you can see that we've customized the colors here. By default, these are just going to be black. We've customized them just to kind of show the range of options you have in Open Dental. You can always customize colors. You can customize the priorities. So, for example, if you prefer this to say visit 1, visit 2, visit 3, you can easily change that. You can change the colors. We can see that the wait priority here is kind of a grayed out. And from here, I can save these treatment plans. So I can highlight all 3 of these procedures and save a treatment plan. Now, saving a treatment plan will automatically create a PDF of the treatment plan and send it to eClinicalWorks. So this treatment plan now exists in eClinicalWorks as a PDF, so it's available for medical providers, it's available for dental providers without even launching Open Dental. It's automatically there and available from ECW. I can print the treatment plan, I can email it, or I can have the patient sign it. So if I do the signed treatment plan, I can see it's going to have my practice information here. It's going to show the tooth chart, show the procedures, and there's an area here if you have a Topaz pad or a touch screen with a stylus, you can have the patient sign it. And it indicates that we have a signed treatment plan. Now, this saved treatment plan, I can give it another name. Maybe we'll just call it fillings here. This saved treatment plan is a snapshot. So if I were to go and complete these 2 fillings, it would indicate over here that those procedures were done, but they wouldn't disappear. The saved treatment plans aren't going to change. The 2 procedures would disappear from the default treatment plan, but these saved treatment plans will always be there kind of as a record of your communication with your patient. I can save another treatment plan. Let's just go ahead and save one more. So it'd be very easy to go ahead and save the next couple of visits for your patient. It'll give them subtotals of fees, just kind of give them a nice looking treatment plan to show what's going to happen in the next visit. So the next step is we're going to go back to our chart module, and we're going to go ahead and complete our procedures. So let's add in a comp exam here just because we're doing a new patient visit. So we'll add in a comp exam as well, and we'll say that maybe today, we'll say we just did that comp exam was the only thing we did today. So to complete those procedures, I'm going to go to the appointment. Now, you notice here that the appointment is highlighted in yellow. Anything that's happening today will automatically be highlighted with a yellow background. It really makes it stand out, makes it nice and easy to find that appointment when you're looking for it. So I'm going to go to my appointment and double-click on the appointment. I'm going to look at my list here, and I'm going to say, here's my comp exam. So I'm going to click on the comp exam to attach that comp exam to my appointment. And I'm going to change my appointment to complete. So I'm going to say my appointment's been completed, and I'll click OK. So now I can see that my appointment here is still highlighted in yellow. I have the comp exam on the line here showing me what we did on this appointment. And if I scroll down, here's my comp exam. This status changed from treatment plans to complete. And I can see I have a default note here. So every procedure has the ability to have a default note that as soon as you complete the procedure, this note shows up. So if you have a certain note outline that you like to use for a comp exam, you can have it just automatically appear as soon as it's completed. Those default notes can be different for different providers, so each provider can have their own default note. And if you don't want to use a default note, there's a couple of other ways to create notes. So for example, I can double-click on this procedure, and I can enter more notes. I can always just type out whatever note I want. The other option I have is what we call auto notes. So the auto notes are a very handy feature. They let you fill out a note quickly. So the basic level, it'll put in a block of text. So you can say, medical history, allergies, whatever information you want, and it'll just put the block of text there. But we also have an extra feature that will actually let you use pop-up boxes, we call them prompts, to help you fill in that note. So I'll show you an example. We'll go to Auto Notes, and we'll do our comprehensive exam auto note. So I can see that it fills out this block of text, exam provided, reviewed medical history, but when I get to oral cancer here, instead of having to click back there later and type in the information, I actually get a pop-up box that helps me fill that in. So in this case, it's a yes or no. It's just a list. I have 2 options. I can select yes or no. I say OK, and it automatically fills that in here. Another example, this one lets me choose multiple options, so I can indicate multiple choices. Again, this one lets me select multiple choices. And for example, this one will just let me type in any information I want. I'll say OK, and now I can see my note is complete here. I can also go back and add more information, so I can add in whatever information I want. This is a very easy way to fill in a note when there's kind of a set of common responses. So for example, medications. Maybe a lot of your patients are taking the same 5 or 6 medications. So instead of typing them out each time, you can have a box pop up and you just kind of check them off from a list and it automatically fills them in. So that's a very handy feature to quickly add notes. I'll say OK, and now I have my nice note here. Again, I'll go ahead and sign the note, and I'll click OK. And see, here I have my note. Now, if I needed to make changes to the note, I can always double-click on it, come back here and make changes. Now I can see if I make any changes at all, even as simple as adding a blank space, it does remove the signature. So signatures in OpenDental are tied to a certain set of data. If anything in the note changes, it automatically removes the signature. I'll go ahead and sign it again here and say OK. You do have access to all the previous versions of notes. So if I go to my Show tab here and I go to my Audit, I can see every previous iteration of the note. So for example, it started with the default note, then I changed it, I added more notes. I have this new note, it indicates that it was signed, it indicates what user created the note, when it was created, and what the changes were. You can also set security permissions to prevent people from editing completed procedures. You can specify certain users can never edit completed procedures. You can set date limitations, so users can edit completed procedures up to the end of the day or a week or a month. And you also have the option to do a lock, where we can add a lock button to the procedure to kind of match the way eClinicalWorks works. You would have, when you were finished with your note, you could lock that note, and then it would be there forever. You wouldn't be able to change it. You would be able to append notes to the end of it or invalidate the procedure, but you wouldn't be able to actually make changes. So that's another security option. So we're almost done here. We've talked to our patient about treatment. We've added our notes. We've completed our procedures. The final step here is to send those procedures back to eClinicalWorks. So to do that, I'm going to go up to my appointment, and I'll double-click on my appointment and use this Finish and Send button. So what this does is it's going to send a message back to eClinicalWorks telling eClinicalWorks that we completed a comp exam. That way, eClinicalWorks will have the information it needs to bill the patient, to create the insurance claim, meaningful use data. It'll be able to handle all that because it'll have the information about what was completed. So I'll go ahead and click OK. And that closes OpenDental, and it takes me back to eClinicalWorks. Now, if I go to the patient documents, I can see I have 3 documents here. I have 2 treatment plans that I saved, and I have the progress notes. So like I said earlier, those treatment plans that I saved automatically show up here. So if you have a medical provider who doesn't even have OpenDental installed on their computer, they can easily see the next treatment plan for the patient. They can also see the patient's dental progress notes anytime they want to. And if I refresh the screen here, down at the bottom under procedure codes, I have my comp exam. So that comp exam did transfer over automatically from OpenDental into eClinicalWorks. So that's the interface at a fairly quick overview. Basically, you create your patients, you create your appointments in eClinicalWorks, and then from then on, you kind of do all the dental charting, all that aspect happens in OpenDental, and then we send the information back to eClinicalWorks. So it's a very smooth, very easy-to-use interface. Obviously, there's a whole bunch more features to OpenDental. We don't have time to go in-depth into everything today, but for example, you can track lab cases in OpenDental, and that's something that can be done from either OpenDental or eClinicalWorks. You have the ability to do perio charting in OpenDental. I'll show you an example really quick of what that would look like. So when you enter your information into OpenDental for the perio charting, you can enter values for probing depth, for mucogingival junction, gingival margin. It'll automatically calculate the clinical attachment level. You can enter furcation, mobility. You can indicate plaque, calculus, bleeding, and separation. Once you've entered all the information and generated a nice perio chart, you can easily generate a 3D perio chart. Looks very nice, easily indicates all of your depths. Consent forms are very easy to do within Open Dental. Again, this is another example of something that would be available from either eClinicalWorks or Open Dental, but I can easily click here and take a look at an extraction consent. So I can see it automatically fills in my patient name, the date, my default text here, which I can edit if I want to nice and easily. I can enter my tooth numbers and do a signature. These forms are completely customizable. Very easy to make changes, very easy to duplicate them if you wanted to make a separate consent, maybe a nitrous consent or other consent forms. You can print and email them, create PDFs, and they'll always be here in the patient's chart. We have the ability to show a larger version of the tooth chart. If you want to do this, this is handy for maybe explaining treatment to a patient or for referring work out. You can save a copy of that tooth chart to the images module. So that will save a copy of the tooth chart here in the images. It's very handy for ortho and pediatrics offices where the tooth chart tends to change over time. We have very customizable exam sheets. So for example, I'll show you one example here. This is an exam sheet that you can have checkboxes, you can have areas to enter text, you can have pictures. Very easy to create very detailed custom exam sheets. They're always tracked here in a list, so you can always go back and compare previous exam sheets. Pop-ups are a very handy way to make sure information is caught. So for example, maybe this patient has a severe allergy. You can create a pop-up, and then as soon as the patient's chart is opened, let's go back and open that chart again. It'll give us a pop-up to warn us of that information. So if you're concerned that someone might not notice an allergy over here in the medical panel, you can always use a pop-up to indicate any information that you just really want to make sure doesn't get missed. Imaging button. So for example, here we have a Dectus button. You might use any of a whole bunch of different imaging softwares. We do bridge with a wide variety of imaging software. The way that works is you'll have a button in Open Dental for your imaging software, and you'll click that button. Open Dental will automatically launch your imaging software and bring up the correct patient. So it's a single click, and you would be looking at the patient's x-rays. Very easy interface. For other documents, we do have an images module here. This is basically a document repository. So in this case, you may use the patient documents in eClinicalWorks, but if you have dental-specific documents, we have a document repository here as well that you can use to store documents. Communication logs are an easy way to keep track of communication with the patient. So for example, I could create a comm log and say, maybe the patient rescheduled an appointment. So I can say this is next visit related. It was a phone call we received. These visit types are customizable. I'll go ahead and say OK, and now I have a communication log here in my progress notes. So there's a whole bunch of features. We kind of went through some of this pretty quick, but that gives you a nice overview of how the interface works. And if you have any further questions, I would definitely recommend getting a hold of us. You can call us anytime. Let me go and put up the information here. The best email address for us here is ecw@opendental.com. That goes to a team of ECW specialists that can answer any questions you have. Otherwise, you can always go to our website, just opendental.com. And here's our main phone number. You can call us. If we go to the Contact Us page, you can see our hours here. And you're welcome to call us anytime with any extra questions or email us if you have any questions at all. Thanks.